Welcome to this educational video on understanding infertility, its causes, diagnosis, and pathways to care. We aim to destigmatize the journey and demystify the science of fertility. I am Dr. Azuka Chinwekwu, a consultant obstetrician/gynecologist and public health scientist. I am also the founder/team lead of DACE Medical Consulting and Communication Services, Abuja.
Please subscribe.
Infertility is defined by the WHO as a disease of the reproductive system, characterized by the failure to achieve a pregnancy after 12 months or more of regular, unprotected sexual intercourse. Globally, it affects 1 in 6 adults, and in the African context, it affects roughly 1 in 8 people. Infertility is largely a shared medical challenge, with contributions from female, male, and combined factors. Education is vital to break the stigma, preventing delays in treatment and guiding couples toward evidence-based care. Infertility is strictly classified into 2 categories. Primary infertility is when a person has never achieved a pregnancy. Secondary infertility is when a person has achieved a pregnancy at least once, but is currently unable to do so again. Shared risk factors include advancing age, infections, medical history-like complications from unsafe abortions, hormones, genetics, substance abuse, weight, and environmental exposure to toxins or heat. Biological causes of female infertility include ovulation issues like PCOS, fallopian tube issues from infections or scarring, and uterus and womb issues such as fibroids or cervical blockages. Male infertility causes include reduced sperm production due to hormonal imbalances, testicular issues, or excessive scrotal heat. Defective sperm release can result from blockages caused by STIs, trauma, or functional issues like erectile dysfunction. If under 35, with no known medical conditions, seek evaluation after 12 months of unprotected sex. If 35 or older, or with known conditions like PCOS, seek evaluation after 6 months. Dual evaluation of both partners is essential. The diagnostic toolkit involves baseline, hormonal, and imaging phases. Male evaluation includes semen analysis, while female evaluation includes ovulation prediction, HSG, HyCOSY, and transvaginal ultrasounds. In simple terms, male diagnosis centers on seminal fluid analysis. Female diagnosis involves hormonal tests, hysterosalpingogram, HSG, and a pelvic scan. The treatment ladder begins with lifestyle and foundational changes, such as maintaining a healthy diet and reducing stress. This is followed by medical therapy, using medications to regulate hormones or induce ovulation. Advanced interventions include surgical procedures for both males and females. The final step involves assisted reproductive technologies, or ART, such as in vitro fertilization and artificial insemination. Proactive steps include using protection to prevent STIs and seeking immediate clinical treatment for infections. Crucially, avoid engaging in unsafe abortions or relying on unverified herbal remedies, and do not unduly delay family planning. Remember, infertility is a medical condition, not a personal failure. You do not have to walk this path alone. Seek counseling, communicate openly with your partner, and lean on community for support. As we conclude, we turn to the Bible in Luke chapter 1, verses 57 to 58. Now Elizabeth's full time came for her to be delivered, and she brought forth a son. When her neighbors and relatives heard how the Lord had shown great mercy to her, they rejoiced with her. If you would like to reach out for more information, you can contact me via the email, phone number, website, and social media links provided here. Thank you for watching this video. We hope this information helps in navigating the journey of infertility with knowledge and hope.